Okay, so let me share. Okay, so my presentation is on addressing nurse burnout to enhance patient care and evidence-based practice. Nurse burnout is an increasingly prevalent issue in healthcare. Emotional exhaustion, depersonalization, reduced sense of personal accomplishment, and this affects nurse well-being and patient care. And I could definitely relate to this because as an LVN working at a nursing skilled facility, it can be very exhausting because of the nurse to patient ratio is not ideal and it can be very stressful and it weighs a lot on your mental health. Problem statement is increased medical errors, lower patient satisfaction, higher turnover rates. Um, all of these are the results of nurse burnout. Um, Implement a comprehensive burnout reduction program to improve nurse well-being and patient outcomes is ideal to reduce nurse burnout. Um, my research question is, how does the implementation of burnout reduction program influence nurse burnout levels and patient care quality? Um, the impact of nurse burnout. High levels correlate with poor patient outcomes, including infection rates and mortality, because the nurses aren't fully in the correct headspace. They're burnt out, they're exhausted, they're drained. So if they're exhausted, they're not gonna be providing the best patient care. It's not gonna be patient-centered care because they're so focused on, "I am so tired and I wanna get through the shift, and I'm going to do, you know, my best to move through this, but it is affecting them. The need for interventions is a systematic reviews emphasize the urgent need for effective burnout reduction strategies to limit everything that I talked about, the medication errors, the higher turnover rates, and low patient satisfaction. Evidence-based strategies include stress management, peer support, and organizational change can mitigate burnout. If you have like a strong team supporting you and really trying to be there for you, like your mental health and everything to ensure that you perform best at work, it's so, so nice because you know that your hospital and your team has your back and they stand with you. Interventions include mindfulness training, resilience workshops, and changes in work environment and culture. These can all help reduce that. Objectives. The objectives are to reduce nurse burnout by 25% within 6 months, improve patient satisfaction by 15% within 1 month, because patients are all going to have their own personal opinion. So if we can improve that the best we could, that would help. That would help improve the patient satisfaction. Decrease nursing turnovers by 20% within 1 year, enhance job satisfaction and professional fulfillment. Because if you're going to work every day and you're just feeling the dread and you don't have support, you are not going to be fulfilled and you are not going to perform your best. So it's very important to provide that to nurses and staff. Intervention strategies include mindfulness-based stress reduction. Weekly sessions on mindfulness and stress management can help reduce, nurses that are in distress. Peer support groups, regular meetings facilitated by trained counselors is very helpful. Also, just like those weekly meeting group huddles to help, decompress and take out all your frustrations, what you may be having with the hospital, with staffing, with management, whatever it may be. to be able to express those feelings and those concerns so something can be done about that. Also, resilience training workshops focus on resilience, time management, and self care practices. Knowing when you need that time off and when you need to step away and not take on too many hours. Because I know, overtime and all that. Organizational changes, staffing ratios, and shift schedules ensure nurses are not overworked, making sure that nurses aren't taking on too much because that is, you know, such an easy way to get burnt out too easily. Like a new nurse working so many shifts, picking up overtime, picking up where they need to be picked up because they feel like they need to or they can't say no. I know sometimes I feel like I can't say no and I need to step in, and then I have to reflect and think about, wait, I can't be doing this because I'm in school, I'm doing this. Like it's just all a little bit too much. And also having the proper support systems, administrative backing for workload management, recognition programs for nurse achievements, like the Daisy Awards and stuff like that. That's always so nice. And if your like hospital has other things, like just like nurse appreciation is very nice. Um, Also, career development opportunities would be helpful to um just improve and like more of like a motivation, like motivating nurses and having that excitement at work is really nice. Implementation plan, the preparation phase, months 1 through 2. You want to secure administrative approval and funding, recruit project team and train facilitators, develop educational materials and resources. And then 2, implementation phase, months 3 through 8. Launch the MBSR program and peer support groups, implement organizational changes, conduct resilience and self-care workshops. Um, and 3, evaluation phase, months 9 through 12, conduct pre and post intervention surveys, monitor patient satisfaction and turnover rates, and collect qualitative feedback from all the nurses to ensure, like, hey, is this really working? And hearing the nurses' feedback, like saying, I'm so happy you guys implemented these things. This has really helped in so and so ways. Evaluation methods for burnout levels could be the MASLEC burnout inventory, patient satisfaction, standardized patient satisfaction surveys, nursing turnover rates, HR records, and qualitative feedback, focus groups, and individual interviews to ensure, like, how they really feel about it. Is it really working? And, patient surveys, seeing at the end of the month, maybe end of the year, what has really changed and comparing it to the previous years and see if it really has improved. Ethical considerations, informed consent, ensuring participants are fully informed and voluntary, confidentiality, maintain privacy and confidentiality of the participants, support for participants, provide support for those um, experiencing severe burnout to ensure that their mental health is okay because mental health is so, so important. It would be a tragedy to lose someone over something that is very fixable. And it's much better to implement all these things at a hospital to ensure your staff is well taken care of than such a tragedy like that to happen. Expected outcomes, significant reduction in burnout levels, improved mental health and well-being of the nurses, like an uplifted staff, enhanced patient satisfaction, better interaction between nurses and patients is always the best because that improves with the patient outcome. Lower turnover rates, reduced recruitment and training costs, improved patient care continued continuity because the nurses are there, they know them, they know the systems, they know the hospital, and it's so much better for the patients. Increased job satisfaction, foster a sense of accomplishment and satisfaction among nurses because they feel like I'm happy to be here every day. I'm happy to wake up every morning. I'm happy to come in on the days that I wouldn't usually work. Like, I'm happy to work on a holiday because I love my job and I love what I do and I'm happy doing it instead of feeling like, oh my gosh, another day of these days where I just can't wait to get out of here, you know? Um, Broader implication cultural of well-being and resilience can lead to a sustained improvements in patient care quality and serve as a model for other healthcare institutions. Conclusion: a comprehensive burnout reduction program to enhance nurse well-being and patient care and foster a supportive work environment, reduce burnout, and improve healthcare quality throughout evidence based interventions. Because that's how you know it's really working when you could see the facts, you could see the improvement, you could see the surveys improve, you could see the patient satisfaction, you could see the reduction in medication errors, you could see the reduction of hospital acquired infections. All of that is reduced, and it's nice to see the the correlation between the two. And that is my presentation. Here are my references. I hope you enjoyed this. Thank you so much. Bye.